I think we'll call the meeting to order, and this meeting is being recorded. And if you just want to go around and introduce yourself for the
David Ropeek.
Dottie Bernard.
Jim Whalen.
And I'm Melanie Deneen, Director of Board of Health.
And it doesn't look like anybody other that is on the board is remote tonight, so I guess we are okay to start the meeting at this point. Yeah.
You have quorum. So.
Okay. So we called to order, and I guess the first agenda item is going to be approval of the minutes from September 17th. Is there a motion to approve the minutes, or does anybody have any issues with it?
I have a very slight issue. I'll move to approve just after my name is added as a attendee.
Okay,
You were here in person,
I was here in person.
so I'll just add that to, add your name. Sorry about that.
And then I move to approve the minutes as written.
okay, is there a
I
second?
have to abstain, I wasn't here.
Okay, so I guess
I don't know, that leaves you.
we second it. Did I second it?
Can you quickly read them?
I read them and everything looks fine to me. Yes, I approve what I read. How's that? We've got three.
So we have three, okay, I guess all in favor?
Right.
Aye, are you opposed? No, so the minutes are approved from September. Moving along to the board member reports. I do not have any report from the chair standpoint, but David, do you have any report from?
Yeah, the 229 subcommittee, the oversight committee,
Yes.
to differentiate it.
Yes.
It's been interesting with the government shutdown and what effect it's had on the work there, which is none.
Oh, really? Okay.
Yeah. The money's all been set aside. And the precedent from the previous Trump administration was they'd like to get these sites back into use. So they're not a target. So the main EPA person who's been working on it still is. They've gotten the site pretty ready for the big last piece of work, which will happen next year, which is digging a wall around the holding basin. It still has stuff in it that we don't like. And then now it's dormant, effectively. Not much happens over the winter.
Okay.
The end.
What was that? Okay. Do you see most of the activities gonna be happening, like when do they usually pick up? again?
Springtime-ish, I don't know exactly.
Yes.
I don't know exactly. So they have to, they need to be able to work with soils. Which is harder to do when it's all rock solid.
Cement. Yeah.
Yeah.
Exactly.
Yeah.
Okay. All right, excellent. Thank you. Any other board member reports that? No?
No, Portia went to the last meeting for the, board chair breakfast.
Yeah. the chair.
I did send it out to every board member today to just set up for discussion. If you wanted to discuss who was gonna go there.
I can attend.
You can attend, oh,
Yeah,
good.
but if
Okay.
anyone else, I don't want to grab it from anyone. Okay.
Oh,
happy
no,
days.
that'd be a
Wednesday
big
the
help,
19th.
yeah.
Yeah, I sent out.
And I'll touch base with you what you'd like me to present or say there.
Unfortunately, at this point in time, I can only do Fridays, so anything that happens during the week. I'm hoping maybe we can split it up a little bit. I don't know,
I went once and it was fine and I can go again.
Oh, excellent.
I'm Dottie do it this time and we'll figure out next time.
Yeah, that's great. Thank you, guys. Thank you for doing that. All right, so Dottie will be taking that piece of the puzzle. So the next item would be the 2026 calendar review.
Yes. We are reserving the room now, all rooms for the calendar. So I need to get this, make sure we have the spot to meet and have it on the town calendar. So I just want to, we do the third Wednesday of the month. This is what it looks like. What? David?
Great. No, I'm just getting used to how the town works, having just joined, like, we're planning out the
Oh, yeah.
schedule and stuff, but of course.
Of key importance that sometimes is conflict, February 18th is the third Wednesday, that's vacation week.
Right.
Sometimes the board chooses to move that one.
Off of school vacation week, public school vacation week.
Yeah,
Yeah.
and do the week later. The downfall is then we will be, one is close together.
Right. I mean, I don't wanna, do it for my own selfish reasons, but I probably would wanna move that date, February 18th to the following week, because I think as of right now, I've taken that as a vacation week. Just for the kids, that doesn't necessarily mean I'm going anywhere yet.
Again, that is,
So
I
could
mean,
potentially be here, but I don't wanna switch it before, I'm sure Portia has young children too, she
it's just,
probably would be on that May side also.
yeah, I mean, that's up to the
Possibly,
boards. I
maybe.
mean, I have to then, look to make sure that the room's available.
Okay,
We're sharing this space with a couple other committees. So, what I'll do is, oh, there's Dr. Crane. It's hard for me to talk and manage this at the
yeah,
same
yeah.
time.
Is he joining us by Zoom? Oh, there he is, okay.
Hi, guys. Sorry
Hello.
I'm late. I'm having internet connective issues where I'm at. But you can see me?
Yes,
Great.
Are you up?
welcome.
Are you up in foliage land?
Yes. Yeah, Portland, Maine. I
Oh.
just got off a clinical shift up at Maine Med in the ER.
Wow.
Good to see
So
you. Yes.
we're discussing the calendar.
Okay.
That I sent out as part of the packet. And proposing to move February 18th to 25th.
That sounds good to me. Yep. With the school vacation week.
Yeah, we had 2 votes so far to maybe move it, but I'm not sure if anybody else has any objections to that. I mean, it's kind of the middle of the winter anyway, so. Yeah, maybe we should move that to the following week.
Yeah, sounds good. I would vote for that, certainly.
Were there any other dates that were conflict, Dr. Crane?
I don't believe so. Let's see. Are we doing December 17th? Or was that one
Yes.
moved?
Yeah, no.
We're doing that one, yes.
December 17th is.
Yep, that works.
Is. What
Is
we're
on.
having. Is
Great.
on.
Perfect. Yep, and then, I'll be at a conference on the 21st of January. But I may still be able to attend via Zoom, if that works for everyone else. And then moving the February one looked good. And then I think everything else looked fine. Yeah. That works for me.
April 15th is before public school vacation.
Yep,
And Easter is April 5th, so we're all in the
Oh, so
clear.
it's clear there.
Yeah.
Okay. Excellent.
I did try to check the different calendars, but it's always, sometimes you miss one, so just trying to double check that. So
Yeah.
what I guess, do you wanna vote on that?
Yeah, why don't we vote then on whether or not we'll keep these dates with the exception of the February 18th one, which we're gonna move, do we decide to the week after? Yes? Okay, so
I made a motion to approve the
Okay.
calendar.
is there a
I
second?
second that.
Okay, all in favor?
I,
Aye.
Aye.
All right, so it's
Stepping
approved,
down.
and no opposition, so the motion carries. All right,
Melanie, quick request. I had connected on my phone while I was getting internet restarted where I'm at. And yes, thank you. I'll now connect through my
I'm
computer.
sorry, I'm trying to watch that and, right, and do things at the same time. There you go, I admitted you.
Thank you. Got
There
it.
it
Thank
is.
you.
Great.
okay, so the next agenda item that I'd like to discuss is just a question of Board of Health training and Melanie, this is what we were kind of talking about just briefly, as far as, you know, how the board feels about, you know, getting a little more, like when you become a new board member, maybe going and kind of going with an inspector to kind of see what goes on. I think it would give us all kind of a different perspective. I've talked with Melanie over the years and like she said, it's always available if people are interested, I guess. Is
Yeah.
that right?
Yeah.
To kind of, you know, if you want to see a food inspection and go along and do a ride along, kind of like as an educational thing. I thought that would be kind of neat from, you know, my own education standpoint, you know, doing that. And then there was the question of whether that should be like a mandatory thing, whether, so you should do one, as a board member, do one mandatory ride along in your tenure and, I don't know, I just kind of wanted to throw it out there to the board and see what people think. I know that, you know, some people have the experience already and kind of know, but you know, some people come from like a hydrology background or, you know, some other background where they may not see the food services aspect of it,
Or you're
or,
on the other side, you're the homeowner and you've seen your
Or
septic,
you've-
but you
yeah.
haven't seen it from the viewpoint of the inspector.
Right.
So, or, you know, so I think.
or even to go to see like sampling of White Pond or something like that, or something to that degree, which I think would be pretty fascinating to see.
As long as it's not a burden though on public health in terms of scheduling and doing it and this and you know, oh, it's raining today, we're not going and.
I mean, my feeling is that it's open invitation for anyone. It's not a violation as far as I know of meeting law. If you wanted to come, any one of you individually, you can't all come together or else the meeting. No, then then I have to post it, right? But if you wanted to individually learn about something, and what we do has a wide breadth. So if all 5 members wanted to learn everything we do, that would be a task, not insurmountable. But I mean, I think I want to be transparent. It's nothing we do is a secret, right? It's enforcement of the you know, state municipal codes, our own local Board of Health regulations, a couple of our town bylaws. So nothing we do is like a secret. I guess I'm always been, when it's come up, like, what are you trying to understand? Is it a food, like, what do you want to learn?
Mhm.
Right? Like, what are you looking to get out of it? I think the handbook, as far as the scope and the broad width of what Mass Association of Boards of Health has under the responsibility of Board of Health is very broad. The Mass General Law on what is a nuisance and what constitutes our responsibility as a Board of Health is broad. But I think for me, it's an open door, like I'd like to learn and go out on a food inspection. It's just connecting our schedules,
Mhm.
right? But I guess I'm wanted to hear, there's something I think you're looking for. I don't know what that is.
Well, I think it would be, you know, from my standpoint, probably Dr. Krings also is that, I mean, we'd probably be less interested in more like a health clinic scenario versus like something that we have very little experience. Well, I have very little experience, which would be like food, you know, a food inspection, like
Right.
what goes into that, like how do you?
What I'm hearing is that you need to come with me on a food inspection, and that's great.
Well, yeah, but.
We should schedule that, so I can get you to talk about the 5 risk factors for foodborne illness, what we do, and I can give you my spiel. Cause I think that would be interesting, cause I think that's kind of, you know, versus taking you to a housing inspection, that's you know, or a pool inspection, or like other things that we do.
Sure.
Let me ask,
Mhm.
this is an interesting topic, being a newbie and feeling very clueless. What would help you if we all understood things better? So it's not just our curiosity. How functionally would our
So
training broadly considered help you?
I don't need you to do that.
Okay.
But I'm open to it, like, I'm not opposed to it. Does that make sense?
No, it totally makes sense, and I want, because
Um,
you're, you know, I want to be knowledgeable as I do this, and whatever you suggest beyond the documents you've given me.
I feel like if you wanna learn the code, you can read the code.
Yeah, no, right, that's readable. So I'm just putting it to you whether there's anything else that you think training would broadly, informally.
You know, training, the Massachusetts now has a very formal, it's called train, literally like the train leaving the station. And there is a really broad, it's called the Foundations of Public Health Practice, a whole training series that you can take. And it talks about all the different inspections that we do. And I think that if somebody had time and inclination, besides the in-person, which you can't replace, but that goes over all the fundamentals of everything that we do on the different topic
Is
areas.
that online somewhere?
Yeah, and I could send you, you could all make, as boards of health, you're eligible, I could send you the link, you could take that training, you could then. It's just a lot for me to think about, like how do I, it's like training you to be an inspector, I don't really wanna do that.
Well, I
You
think, I
know?
think with some discretion, we could all log on and nose our way through it to get some general background knowledge without becoming
Sure,
that
that's-
trained.
It's, I've done about half the courses.
Oh, yeah.
Okay.
Oh, you
So,
did?
yeah, just,
Yeah, so what do you think?
some of they're 1 to 2 hours each, many of them. Sometimes it's very basic. What is public health? You know, and then they get into each module. It can address something very specific. So it was really enjoyable.
Yeah.
The other thing I want to do is just make a plug. I don't know if they're still holding it, but twice a year in May and November, the local Public Health Institute LP, used to give a training for new Board of Health members. And it was free,
Yeah.
and when, and
Right,
it was always at the Marriott in Marlborough and Taunton. I only know because I had to present at it every year for years, for work. It was great, you know, it's like a crash course. 45-minute modules, and again, it's also really interesting to talk to other new Board of Health members from other towns. That are saying, oh my God, I don't believe what's going on in Watertown or my town.
Right.
So at
So it's like a
lunch, you
networking
learned
thing.
almost as much as going to the modules, so it was fun, and the modules were environmental health and inspections and emergency preparedness. And
So you came in with a fair degree of knowledge and you've been on the board for a while. Would you recommend that one or the other of these resources be a informally suggested step for new members?
Well, it's hard to give up a whole Saturday, you know, like you, but I really enjoyed the in-person one because it was truly like a crash course. And you got to hear everyone else's questions as well. For the new board members saying, you know, can you explain again about the number of bedrooms and the septic? And so you all kind of learned together, and it was fast-paced. And again, you could kind of choose which ones you wanted to go to. There was the legal nuts and bolts of isolation during a pandemic. So, for example, so board members would understand what they might be asked, or, you know, health director. So it was really interesting, and the topics did change every year. So it wasn't like every year the same slate was trotted out. So,
and I wasn't aware, or probably if I heard about it, I didn't, not a new Board of Health member, so I might not have, but we can definitely, I feel like. There's a lot of different options out there, but we can look into that.
yeah, I don't know if they still do it. My old boss at Harvard, Marcia Testa, kind of was responsible for it, so that's
Okay.
why we were so involved in it. She was Board of Health member in Wellesley. And then,
I spoke at one once myself, but
yeah,
I spoke and left.
Yeah, yeah.
I wasn't there to learn. So, you know, I wonder whether we could embed somehow that when new members or existing members want to. What's your suggestion about how valuable that would be to help you do your job, or me or Jim, or do our jobs better?
I think it was valuable to learn what a Board of Health member does and doesn't do. That's almost as important, you know,
Yeah.
because sometimes you come in with wrong assumptions. And again, the networking, not networking so much as learning about other towns and what that Board of Health, and it made you feel really part of this community, this whole group of people, you know,
Something like
dedicated.
there, even if we leave it to, yeah.
Yeah, so
Like the topic.
that was a unique vibe of the whole thing that.
But you're not
was
sure
all
whether they
these
still
people.
do that program.
I don't know about the funding. LPHI used to have a lot of training and, you know.
There's a lot of training on that train. Like
Right,
that's
on
the
the
same
train
institute,
system.
local boards of,
Maybe it's gone online since COVID then. Have
I
you
know.
done it since COVID?
I think so. I think I sent it out. It was like Saturday, a couple years ago.
You did see it then, okay.
I believe so. It was like on a Saturday. It was like MAHB was putting on a
Yes.
Saturday.
MAHB,
It's
that's
Mass
right.
Association of Health Boards.
That's right.
It's a Saturday training and came highly recommended. It was last year, the year before, and I sent it to all of you, but it's like literally giving up your Saturday.
Yeah, you get breakfast, you get lunch.
But I can look into see when it might be again.
Babysitting for the people who have children, Randy, and
You know,
Marcia.
like I guess I,
If you volunteer to babysit, they'll send all the
Yeah.
kids over.
To that end, I think it's, you know, any training or further education in public health should be encouraged, but I think it's also, you know, we selected the members of this board based on their backgrounds and the varying perspectives that they bring, and it's not, I think, a requirement to have a, you know, a level of public health knowledge that Melanie has by any means, you know, to be on the board, right? We selected the members of the board to bring varying perspectives, understanding that, you know, all of us are not public health professionals, right? We're members of our community with varying perspectives, and that's all that's needed really to, you know, bring to the discussion of the board. So I think it can be encouraged, but should not be a requirement.
Good idea.
Yeah,
Good
yeah,
thinking.
fair enough, yeah, agreed.
and I can look into that MAHB training if they have it. And I can definitely send out the the link, and you can make an account and at your own will take some.
Yeah,
online
if you're
training.
lying around after spinal fusion surgery and you have nothing else to do.
You know,
Oh, yeah, hot dog.
and if you had ever had specific questions, you know, it's always an open door to like ask about a topic. It's not, you know, you can send me an email or call, or we can, you know, like it's something that we can arrange if you had a specific question or something you wanted to learn about. Or, I mean, I think I've talked to probably each one of you individually about some things I want to learn about. It's a two-way street. It's a resource,
Sure.
right?
Yeah,
You know, I think
Yeah,
like,
that's why we all got picked, like Randy was saying,
you
for
know,
what we bring to the table as opposed to we're all neophytes.
fresh eyes.
it's just different perspective, which I think is really important.
Well, you think of a lot of boards in town and they're kind of almost focused on one thing, like zoning or planning or something like that, where anybody on that board has that one kind of. But this is such a broad topic that,
That's what's great about public health.
no, this is great, yeah, it's like, it's so encompassing that maybe there's people that touched on a bunch of different things in my career, but. You know, there's always gaps that you'd like to potentially fill, and maybe this is a perfect way to do it.
I will look into that and see what I can find.
Excellent. All right, so I think that covers that. I don't think we're gonna vote on anything. I think it was just something like an object. I think that one of the things that Melanie has discussed, and I think is great, is that we have a very lively group of people that have great topics to talk about, and I think that if anything comes up, I think we should discuss it as a group. Cause and we can put it on for the night, we can stop the conversation at that point and maybe put it on for the next agenda topic. If it's something really that we wanna kind of dig into, which is great, because I think we have a lot of good topics to go through, so. And this being one of them, so this was an example anyways. Okay, moving along to the next agenda item, it is the public health nurse report.
Yeah, excellent. I am excited to share that Friday we had someone accept an offer to be the public
Oh,
health nurse for
Yay.
Concord and Maynard. It's a pending, you know, clearance, so I don't have, you know, the background and everything. So can't give you a name yet, but hopefully by the next meeting. And we had actually a busy public health month. This week alone, last week we had 3 flu clinics. At the Council on Aging on Monday, they had 112 flu vaccines with 90 COVID, Council on Aging. That is mostly high dose, but a few under 60, 65, so a few. On Wednesday, we had a flu clinic for employees here. In this building, we gave 39 total for flu and 28 COVID. And then on Thursday, Dottie helped tapped her to help, at the middle school, offered, the flu clinic at the middle school for 27 flu and 17 COVID, just at middle school
Are you
teachers.
handing out the stickers or the lollipops or?
No, insurance cards. But the teachers were really thankful that it was right there. Some of them really dashed in, like almost between classes,
Yeah.
dashed in, pulled sleep up, thank you.
And back to
So,
work, yeah.
Yep,
They were very, very thankful.
Yeah.
Oh, good.
so that was great. All, the vendors saw Dino and Acton, West Concord Pharmacy. That's
Oh,
who,
great.
gave the flu shots for us. So that was, a big activity. Also, the week before, we planted about 100 bulbs again of yellow tulips out in front of the BD Center for the Mental Health Awareness Yellow Tulip Project that Emerson Hospital operates and sponsors. They gave us the tulips. But we also purchased, with opioid monies, another set of bulbs, because First Parish wanted to plant. So First Parish is gonna participate and plant, and another set of 100 bulbs for West Concord Green Thumbs. Is that the
Yeah.
right group?
Yeah,
They're going to plant 100 bulbs either around the West Concord Library and or the train station. There's a garden somewhere near
yeah.
the train station. So those folks are gonna be planting those bulbs. So
Take
hopefully,
2 steps past it and you missed it, but it's cute.
yeah, I think,
These little street things.
I was working to solicit other helpers, other people, like, I didn't wanna plant 300 bulbs. And I wanted to have representation. Last year, we tried to do something at the Council on Aging, and there's a lot of construction there right now, and it wasn't gonna be a good site, and I wanted something in West Concord, so they said Nicole at the Council on Aging knew somebody in West Concord Green Thumbs, and they said, sure, we'll do it, so that sounds great. And then I submitted, last week, the opioid settlement report, showing what we'd spent for money. We didn't spend all the money we received last year. We spent the money, $12,000 on our contribution towards Olivia DeFore. She's the substance use prevention coordinator that has come to this group. That's what we spent the money on, as her salary. But as we're ongoing through the end of December, doing the opioid survey, that'll help inform what other activities people in Concord are interested in seeing. And I probably will have her come in January or the February meeting and present what was found
Is
to the
that
board.
something, I know that you've had trouble getting satisfactory participation in some other surveys. Is this particular survey something that we could do maybe with the bridge or other ways? Make more people in town aware of to encourage participation so that the findings can truly inform good decision making?
So the answer to that is yes, but I did put an ad in the bridge.
Okay.
I did have the schools put it out for the schools, so their newsletter. I did I learned a lot from the last go round. There's paper forms going out for the Council on Aging, and then their Concord Carlisle adult and community ed at the high school, that program, they sent it out. So I'm trying to, so anywhere, if you have an idea, you wanna help get people to do it, I'm taking all volunteers. Any ideas? But like, I'm open to, but it's at the library, I sent it out to news and notices, but yeah, how do we reach people?
Well, I always bring up the bridge, and hi Trace, you're on the phone. It reaches everybody.
Right,
Town is doing this thing, and it's.
I just can't tell the bridge what to say.
No, you can't, but you can call them and suggest it might be a possible story. We're doing this survey. We've had less than satisfactory response from other surveys, and maybe a story about the fact that we're doing this, so that, not just an ad, we know what we're talking about when we decide to spend the opioid money and can spend it in the community's best interest. Then they'll decide. That's their choice. That's their
Right.
decision. But reaching out to them and saying, hey, it might be possible, something of interest would be worth a phone call.
Okay. Are you volunteering to do that? You
I'd
want me
be
looking
glad to, but I don't know much about it except for that you're doing a
Okay.
survey.
Right, that's a good suggestion. I will, try that venue. I have, I placed an ad, I've talked about it, but I think I can do more. I mean, there's no,
Yeah,
that's one of the big challenges is to reach the right people. We wanna reach people with lived and living experience, with substance use, we wanna make sure,
Right,
you know, we have had 1%, so over 200 people respond, but more representative is always better. We are short on men. Somehow, I guess men don't fill out surveys, so we'd like to, you know, make sure we try to encourage everyone in this
Know our
room,
Feelings in general.
to fill out, complete the survey. Cause it's open to anybody in Concord. Lives here, works here, has been affected somehow. There's no limit. So yeah, that's a good idea.
and a story could make it broader than just a little constrained ad that, well, my understanding, if my understanding is correct, we're looking for ways to deal with various forms of substance abuse.
Yes, but we also, the questions are specifically asking about the opioid money, like what do you think should happen? Is it prevention? Is it helping those in recovery? It's very specific.
But specific opioid abuse.
And then it asks about other substances, like it asks, there's a question in there I added, you know, to find out more information. about
Yeah,
what
so
people are-
because you've mentioned before that alcohol abuses.
Alcohol is
is
the
an
substance
issue.
in our needs assessment that came out as the one that, of concern
Right.
compared to others.
So if in an ad you say how to spend the opioid abuse money, people check that off as, oh, those drugs. But they don't necessarily mentally include other forms of substance abuse, which that survey can also inform us about. So, but again, I don't know the survey, so maybe I'm talking through my hat.
Okay, well, maybe,
A story has the potential for making substance abuse more broadly a topic that would encourage participation.
mhm. Okay, that sounds good. That sounds a good suggestion. I like it.
I wonder if there's, any groups that we could probably like AA, NA groups, that type of thing in town that. You know, there's people who are running those might have ideas on how to distribute these. This type of thing, I would imagine, like, that would be interesting to see what someone who's in active recovery would be. Interested in how to spend that type of money,
Mhm.
although that may be biased, I'm not sure. But.
I need to find out how to find those people. That
Yeah,
is a great idea. I just don't know how to.
probably churches, that type of
The
thing,
Sunday morning one at the police station.
Right. Okay,
yeah.
so great. And then, so that's, any more discussion on that?
No, I think that,
And then for the month of September, we had 1 case of anaplasmosis confirmed, 12 cases of COVID and 1 case of salmonella. And through 10/28, which is a key date to mention, for the month of October, but not the whole month. The report was 1 confirmed case of norovirus and 8 cases of COVID. But that would lead us into the next agenda item, which is pertussis.
communicable disease.
Okay. We did have 1 confirmed and 1 suspect case at the high school of whooping cough, otherwise known as pertussis. That came in the week before with 1, and then another case last week. The school department, we talked to our public health nurse, we worked with the school, and the close contacts were identified. Everybody was communicated with they were considered a close contact, and close contacts are advised to take prophylactics or antibiotics. And the school department did send out, I believe, an email on Thursday night, just informing everybody what was going on and to monitor for symptoms.
Why does that particular disease raise so,
So,
response?
one thing say that again, Mr.
Strong a response, you know, there are lots of communicable diseases that you don't hear about all of the work you just did happening. Why pertussis?
I don't know why it had a more response than others, because we do have a case of salmonella, a case of, I think, it is highly contagious. I think the vaccine prevention after about 3 years does wear off. So you are encouraged to get a booster, talk to your doctor to get a booster, all ages. Especially if you're either working with children or, in this case, it's common. Something I learned between 10 and 20-year-olds to be exposed to that because of your childhood vaccination schedule. It does that particular one does wane over time.
But there's nothing uniquely severe about the disease compared to some other diseases that go around that make it particularly alarming.
Infants, it's dangerous for the infants.
Well,
They
it's
can die.
mostly.
Yeah, oh,
it's-
yeah.
You know,
very-
so it's the,
Yeah, we're trying to prevent it from getting more systemic. The reason it's one of 100 communicable diseases
Right.
that we monitor and respond to. I wouldn't consider, as of my information right now, an outbreak. I talked to the nurse, that our definition is 3 unrelated cases. We don't have 3 unrelated cases at this point. It's not, in a cluster, we don't have any, like together, we don't have a LART. We have two, 1 confirmed and 1 probable. I did have work with our Great Meadows folks and I can pull it up. So people can see it, a flyer worked up. So this is just talking a little bit about just getting yourself vaccinated for whooping cough. It's in your packet. I haven't distributed it yet. We worked on it today. Here we go, guys, for you online. You can see it now. It is just telling you what whooping cough is, it's communicable, and why we're concerned about whooping cough and the vaccine schedule.
Very nice. Looks good.
Yeah,
I like it nice and clear. I like the graphics.
I guess I didn't know if there was any other questions about what people would like to know. Okay,
yeah,
stop sharing. I probably will post this on our webpage and send it out through the next news and notice as, just information for people.
okay,
Okay, if there's more questions or more things, something else develops, we will keep everybody that needs to know in the know.
okay. I think that's pretty much it that you wanted to discuss from communicable disease. No,
I didn't know if anybody else had any questions, but that's the update that I have right now
Okay.
on the pertussis.
All right, and then I guess the next agenda item would be Public Health Director report.
That's me. Okay.
That's what you had.
I'm gonna print off, so a couple of things I wanted to, what else is going on? I'm on vacation, November 10th to the 19th. So I am working with people to make sure that there's coverage, and all of that. We are hiring and actively searching for an inspector. So we should be interviewing after I get back from vacation for the public health, the second inspector position.
They're generalists, like they can do all kinds of inspections or,
Well, that's what the job description is. So the job description is for a sanitarian and do a public health inspector.
so lots of different kinds of.
Sometimes the candidates have different areas of, expertise or not,
Mhm.
right? And they range. So,
But the job is for a generalist.
it's for a sanitarian, for a
Gotcha.
the job title is public health inspector, but the job inspection includes all aspects
Okay,
of
thanks.
public health.
Learning.
what I'm trying to do, this department traditionally had like somebody that did all the septic and somebody that did all the food. And that was, they had like 2 columns. And I'm trying to make sure it's a cross-functional team that we all, so we can substitute for each other. If somebody's out, there's no discontinued service. So trying to make sure we're all trained and we're all, we're depth at every inspection. So last year we split the camps, we split the pools between all the inspectors. Just so that I do a couple, like we're share the wealth. But I feel that gives everybody, the whole team exposure and all makes us, all work in all aspects of the community. So I think that's kind of the, model I'm going for. I don't have a lot else to report. I think, we have an admin offer that's also been accepted. So I think that position, looking to start that around Thanksgiving or after. So I think that's moving forward. I'm looking forward to that. And I think between keeping just business days afloat and focused on the nursing aspects for the last month, that's had me pretty busy.
Absolutely, yeah, it's a lot. It's a lot.
Does your job change, shift seasonally? The kinds of things that pop up more over the winter than summertime? I'm just curious.
Well, very much so in regards to inspections. So certain times of the year, like in the spring, we do the annual like pool and camps. So in April and May, we're very much focused on pools and camps. Food are kind of year round, but in the fall, we definitely make sure we get to all the schools, we do all the farm stands.
Like infectious disease season, because everybody's inside and people get sick more in the winter. I'm just,
So in the
Anything.
summer, we our trend to have more tick-borne illnesses.
right,
Starting-
mosquitoes, and do we
and then we
spray or
have-
not,
Then
right?
we have, this year was very dry, so we did not have mosquito diseases as anticipated, so we were very thankful for that. We had some West Nile risk. We went up as high as moderate, but we didn't have, when we had, a case of West Nile, but no, it was late in the season and not a lot of mosquitoes. So we didn't have any action. From a spraying standpoint, we're just monitoring and keeping track of what we had out there for disease. And then I think, coming in now, we're heading into flu
Yeah,
and COVID. We don't typically follow up with flu and COVID unless it's in congregate care, like a nursing home. We work or high level, like in the school. If it becomes a significant number, then we work with the school system. So the other types of communicable diseases, all I can say is I hope not. In your packet, we did send out the monkeypox DPH alert about an increase of monkeypox that was mostly not that we've seen that in Concord, but just for your information, Jim wanted Dr. Kring to make sure he saw it for the ED. But I don't have any, I don't know what you know what I mean? I don't know what else could come around the corner. We end up trying to respond.
that's the general question.
Septic used to have traditional, like busy and quiet, but we don't seem to see that anymore. We're very busy. We're going to be very busy out on Main Street. There's a big development.
Yeah.
There's something like 20 or 27 septic systems that are gonna go in there, so that's gonna be very busy for Mike. Or in our whole team, like myself, whomever we have, the other inspector to get those.
Here's your chance, Jim.
But
Yeah,
we don't,
but these are fresh ones. They're not cleaning out the old ones, so this is a tasteful septic.
Stuff.
so we're not gonna have, we don't have too many big developments like that in Concord, so that's not, it's kind of a rare thing, right, to have that many, so I think. So I guess there is.
They're
like
each gonna
these-
have, each unit's gonna have its own,
Yes, I think there's 2 that are gonna be on sewer in the front, but that's it, yeah.
okay. And they're not all like sewered into a single septic system.
It's not a shared system, they're gonna be individual, yeah. Mm-hmm. Yeah. But I don't, so yes, there's definitely seasonal, but not something, that I can always predict.
Yeah.
But there's trends. Typically, we get some complaints in the spring of when people are getting light out, when people are outside and we see and smell and hear things differently, but that is usually in April, and I always think it's because people, it's finally light out and people are going outside. Nothing's changed, it's like every spring, right when we're busy with pools and camps, and it seems to be a little heavy on.
My neighbor's drying her clothes out on a line in the backyard.
I just sometimes people just start noticing things that they maybe haven't seen all year because they're outside.
Yep.
Yeah.
But that's, we're excited. I did finish the plan review for the Wright Tavern, so that is under plan review. And we are working and finalize the plan review for Sally's a Pizza. We're working on the place that'll go in next to Chipotle.
Yeah, what's the schedule for that?
I don't have one yet.
It's right down the street from Randy and Portia in my house, so we're
Okay,
all
well,
keeping an eye on. And by the way, Randy, I tried the one that's up in Burlington. Sally's a Pizza.
Oh,
You know
yeah?
what's going on? Yeah, disappointing, but
Oh,
I'll let your taste buds decide.
yeah. Well, hope it appeals to Concordians.
Yeah,
Yes. Alright.
and then that's the end of that concludes everything I really had to report.
Okay. So I guess the next thing is public comment.
can I, before we go there, can I
Oh,
ask you
sure.
a question?
Yeah.
I had sent you a note some time ago asking, and didn't hear back, but you're crazy busy, so no problem. What the regulations are and who's responsible for them. For the people who work with stone, cutting stone. I've watched several people cutting front walks, stones, not putting stones on piles, but cutting them with the dust,
Mm-hmm.
lethal stuff. Silicon, there's a whole bunch of literature on breathing the dust is really bad for you. And I've seen some people who've been masked and some people who have not been. There's all kinds of crystals and nasty stuff in that dust that's really bad for people. It's not so much a neighborhood problem, because the wind and the dissipation and the level by the time you're next door, but it is definitely a work issue. And I don't know whether that's within our jurisdiction to even look into or whatever. That was my question.
So I don't,
Federal, OSHA, I don't know.
yeah, so I
Who
do
does it?
believe that's the Division of Labor Standards and oversees the OSHA with workforce, but I can double
So
check.
who would like enforce that in some local crew with a saw out down in this cloud of silicon fibers and
Well,
stuff?
if it's a nuisance, it's us.
The nuisance would be the neighbor complaining, right?
Right, but until I get a nuisance, then I can't go around, I don't have authority over that licensure of that, cause. But I believe it's State Division of Labor Standards. But I don't know, I have to look, it's not under Board of Health that I know of.
Yeah, I mean, it's not a big thing for the whole community, but,
Is this like an ongoing thing or is this like?
I watched a neighbor on one side with a crew that was cutting stone, breathing this dust with no masks at all.
Yeah.
I watched a neighbor on the other side and it was coming into our house too, so we closed the windows because it was enough to worry about. And that crew there were two guys masked and two guys who weren't. You couldn't even see them through the cloud.
Wow.
I mean, it's a clear health threat
Yeah.
to the people who are doing the work. And I didn't know whether that was within our purview or not. So that's raising that.
So a public health nuisance is a nuisance to people,
Right?
but we have to observe it. So it's that type of thing, it's hard, because by the time I get the complaint, you don't see it, right? It's not a nuisance if I don't see it.
Okay, so let's say, and this is completely speculative by this newbie, that companies aren't currently required to mask up their workers.
I need to look into it, David. I don't know the answer to
Yeah,
that question.
I don't know whether we could like say you should or have to, or whatever.
Why don't I do this? Why don't I talk to division and find out a little bit about what their requirements are, if there are any? And then I can report back.
Yeah, it's front walks, it's stone walls and stuff. It's, not like rampant, but acute when it's happening.
I do feel that if you made a regulation, it would be hard for me to enforce,
Right.
because I'd have to have a permit. So in order for me to know the work, it's like chasing your tail a little bit to know, was somebody gonna know they need a permit to get a permit?
Well,
to-
they're guys companies who do work that is being done under various permits, so that they have rules that they have to follow
Yeah.
and are given a permit to do so. So
Right.
that just the requirement up front would be,
I think it's something we could put on another next agenda. for-
yeah.
I think it falls under the,
That's all I wanted to do is bring it up as a matter of discussion for further consideration.
let me look into that
Cool,
and
thanks.
then, we can revisit that, okay?
Sure. All right, so anybody else wanna add anything else, David, or anybody? Dr. Kring, any concerns, questions, or agenda items for next week, next month?
Just that Melanie had emailed about the chairs breakfast. I don't know
Yes.
if you guys discussed that before I joined the call or not.
We
Yeah.
did, yeah,
Dottie's
nice enough to step
Wonderful.
into that for
Good,
us,
glad
yeah.
that, and I'm sure you saw Portia's email as well, that she was gonna update us on her visit to the Cheers breakfast last month, so sounds good. Yeah, nothing else from me.
We'll probably have 2 chairs breakfasts at the next meeting, the split.
Well, she was gonna send in, yeah, I asked her to come on the Zoom, but she didn't, yeah. All right,
Okay. Okay, so the last item is public comment. I don't think there's any other. I know that we had that one gentleman on, but I don't think there's anybody else. So I guess the last thing is adjournment, and I guess we will move to adjourn,
I make a motion to adjourn the meeting.
okay?
I second it.
Okay, and to vote,
I
Aye.
aye, okay. Until
Dottie and I talked about this.
the
December-
17th,
December.
December 17th, our next meeting.